Hi there. Welcome to your Bone and Joint channel. This is Dr. Shayesteh, your orthopedic surgeon. Today we are discussing lower back pain. As you might know, it's a very common complaint and common disease. As we said, it's very common. 4 out of 5 people experience back pain during their life. It's a common reason to visit the doctors and also a common reason for the people call in sick or stay out of work. Pain can be mild or severe. It can be sudden or chronic, sharp or dull. Patient can feel the pain in the back, in the bottom, or leg. It can be just only one leg or both legs, radiating pain in both legs. It can change by position, and even sometimes patient can experience some sort of pop sign during the strain of the back. Along with the pain, patient might suffer from the stiffness as well. It might be very tough and hard to move and straighten your back or get up from the bed. So there's a clear decreased range of motion. It's hard to stand up straight. Sometimes there are some other symptoms such as numbness and muscle spasm. Basically, these 4 signs are very common: numbness, muscle spasm, pain, and the restriction in the movement. What are the causes of lower back pain? Strains and sprains are the most common cause. It can be as a result of sneezing, coughing, twisting, or bending over, lifting something too heavy. And then there are fractures in the spine as a result of an accident, like fall or car crash, or certain conditions like osteoporosis or spondylolysis, which makes the spinal bone very prone to fracture. We have elements called disc between the vertebral bone. This can get protruded inside the spinal area and put pressure on the nerve and create lower back pain. It can be a serious pain and cause sciatica pain, which is in the lower back and radiates to the legs. And sometimes we have certain conditions like spinal stenosis. Spinal column gets so tight and thin and puts pressure on the spinal nerves and creates sciatic pain, which radiates to the lower back as well. Lower back and the lower legs as well. And then scoliosis, curvature of the spine, and can lead to the pain, stiffness, and numbness as well, and difficulty in the movement. There are other causes for the lower back pain: arthritis, osteoarthritis, ankylosing spondylitis, that's the inflammation and stiffness of the spine, and then spondylolisthesis. That's a condition causes the vertebra in the spine to slip out of the place. Spondylolisthesis leads to low back pain and often leg pain as well. And then diseases such as spinal tumors, infections, and several other types of the cancer can cause back pain. Other conditions can be the origin for the pain are like kidney stone and abdominal aortic aneurysm, which we have to consider. In any lower back pain, we have to rule out anything related to the kidney and abdominal problem as well. Okay, now we wanted to know how common is the lower back pain and what are the risk factors. As we said earlier, 4 out of 5 people, they experience lower back pain during their lifetime. Age is a very important factor. As we get older, we will get more chance of lower back pain because this gets harder and is not any more soft and rubbery and doesn't provide support for the spine, because usually it works as a cushion, and as it gets harder, it doesn't have that support and wears away, and that leads to pain and stiffness in the spine. Weight. people who are obese and carry extra weight, they are going to experience more often the back pain. Overall health. Your overall health is important. Weakened abdominal muscles cannot support the spine, and of course, even weakened lower back muscles cannot support the spine. These muscles called as a core muscle. If you have a stronger core muscle, you are going to support your spine more, and you will be able to experience less back pain. But weakened abdominal muscles can lead to back strain and sprains. Occupational and lifestyle. Jobs and activities that require heavy lifting or bending can also increase the risk of back injury and back pain. There are some other structural problems as well, such as scoliosis, kyphosis. Those diseases also can create lower back pain very often. Diseases like cancer or osteoarthritis puts the patient in higher risk of lower back pain, especially in certain type of cancers. And even mental health can be the reason for the back pain, depression, and anxiety, as an example. How your doctor can diagnose you? First of all, your symptoms and your history and your physical examination. Your doctor needs to have a thorough examination of your body. And then, in order to have a clear picture of your vertebra, disc, muscles, and ligaments and other tendons, we need to do some other examination tests. First of all, first is spinal X-ray, which uses radiation to produce images of your bone. And then MRI, which uses a magnet and radio wave to create pictures of your bone, muscles, tendons, and other soft tissues. And finally, there's a CT scan as an imaging test. So there are three imaging tests: X-ray, MRI, and CT scan. CT scan also X-ray and a computerized tomography test, which can create 3D image of your bone and the soft tissues. And then sometimes we need to check the nerves or the muscles. We call it electromyography, EMG, or nerve conduction velocity test. See if there is any nerves involved, and as a result, any muscle has been involved. Sometimes the doctor needs to send you for some blood test or some other test like urine test to find out if there is any problem in your blood or your kidney or any other signs and symptoms which might help for the diagnosis. You might ask, can I prevent lower back pain? The answer is you cannot prevent lower back pain that results from disease or structural problems in the spine, but you can avoid injuries that cause back pain. To reduce your risk of a back pain injury, you should do, first of all, maintain a healthy weight. Any excess weight puts pressure on your vertebra and discs. Strengthen your abdominal muscles. Pilates and other exercise programs strengthen your core muscle, which that supports the spine. Lift the right way. To avoid injuries, lift with your legs, not your back. Hold heavy items close to your body. Try not to twist your torso while you're lifting. What is the outlook for the people with lower back pain? The outlook depends on the cause of the pain. Most people with the back strains and sprains recover and they do not have any long-term health issue. But many people will have another episode of pain within a year or less than a year. Some people have chronic back pain that doesn't get better after several weeks. Older people with degenerative conditions such as arthritis and osteoporosis may have symptoms that it gets worse by the time. Surgery and other treatments are effective at helping the people to reduce the pain and go back to the normal life. You might ask, when should I see my doctor? Okay, if you have a lower back pain and it gets better within a week, usually you don't need to see your doctor. And usually simple sprain or strain goes away by medications and treatments and some rest. You need to see your doctor if you have pain that doesn't get better after about a week of at home care. If you have a tingling, numbness, weakness, or pain in your buttock or legs, please see your doctor. Severe pain or muscle spasm that interferes with your normal activities needs to be addressed. Fever, weight loss, bowel or bladder incontinence, or other unexplained symptoms also are the reason that you need to definitely see your doctor. That would be for this video. We are going to conclude our lower back pain video here. I hope to see you in the next video. Please leave your suggestions and comments below, and I will try definitely answer your questions as much as possible. Please subscribe to the channel and see you on next video. Thank you.